Hello guys, now we shall be discussing regarding another parasite that is by name called as Cryptosporidium parvum, right? So we shall be discussing regarding Cryptosporidium parvum. Now what is the important thing can you tell about this Cryptosporidium parvum? What is the important thing which you can tell about Cryptosporidium parvum is that, so what is the disease first of all? What is the disease that this Cryptosporidium parvum causes? It causes Cryptosporidiosis. It causes Cryptosporidiosis. Okay? Now, this Cryptosporidiosis causes diarrhea. So, diarrhea, it basically causes what? Diarrhea in two groups of people. So, one group of people are a healthy people and another group of people are immunocompromised people. So, it causes diarrhea in healthy people as well as immunocompromised. For example, if it is causing diarrhea in the healthy people, right, that type of diarrhea is called as transient diarrhea, I mean temporary diarrhea. Okay, for a less time, for a short period of time, transient diarrhea. For example, if this is causing diarrhea in case of immunocompromised patients, then that diarrhea will be heavy diarrhea, okay, and very severe form of diarrhea. So patient is going to have very severe diarrhea. Okay, so one side there will be transient diarrhea and the other side there will be, in immunocompromised patient, there will be severe diarrhea. Another important thing is that what form does it exist and how it is transmitted. What form does it exist and how this pathogen is transmitted to you. Yeah, what form does it exist and how this pathogen is transmitted to you. So the first way is obviously the form will be cyst. It is always in the cyst form. Now how it is transmitted is by undercooked meat, by eating undercooked meat. By eating undercooked meat or drinking water, right, contaminated water. So mostly undercooked meat, and the form which it exists is cystic form, cyst form. Okay, now how do you diagnose this? How do you diagnose this case? How do you diagnose is that when you look at when you take obviously this will mainly lodge on the intestine and damage the intestine. Okay, but how the damage happens is that when you look at the intestinal glands, when you take the biopsy, put it under a microscope and look at the intestinal glands. Intestinal glands, you would see that there are minute dots everywhere. So these minute dots are nothing but they are Cryptosporidium parvum. Okay, so you take an intestinal gland and then what do you add? Obviously, what type of staining? That is acid fast staining. Acid fast staining. So under acid fast staining you find this acid fast organism, that is this Cryptosporidium parvum. Okay, so I'll show you the picture anyway. So let me show you the picture. So this is an intestinal biopsy. In the intestinal biopsy I can very clearly see dots overall, isn't it? So these dots are nothing but called as Cryptosporidium parvum, and this is an acid fast stain, and that is why they are pinkish in color. Now what will be the treatment plan? How do you treat this case? You treat this case by giving a drug called as nitazoxanide. Nitazoxanide. Or you can also give paramomycin. Paramomycin. Or thirdly, you can also give azithromycin to the patient. Azithromycin to the patient. Okay, so and this is the biopsy material, and these things which you are finding here are these roundish things which you are finding here. These are called as acid fast oocyst. Acid fast oocyst of what? Acid fast oocyst of this Cryptosporidium parvum. Okay, so this is all you need to know regarding this pathogen Cryptosporidium parvum. Thank you so much for watching my lecture. Goodbye.